Which tube is used first in the standard order of draw? A. Lavender. B. Blood culture. C. Gray. D. Green. Answer, B. Blood culture tubes are drawn first to prevent contamination from additives in other tubes. What additive is found in green top tubes? A. EDTA. B. Heparin. C. Sodium fluoride. D. None. Answer, A. Green top tubes typically contain heparin to prevent clotting for plasma testing. Which of the following is used to prevent glycolysis in glucose testing? A. Heparin. B. Sodium fluoride. C. Citrate. D. Thrombin. Answer, D. Sodium fluoride preserves glucose by inhibiting glycolytic enzymes. What color tube contains sodium citrate? A. Red. B. Light blue. C. Lavender. D. Yellow. Answer, C. Light blue tubes contain sodium citrate and are used for coagulation tests. What is the last tube drawn in the standard order of draw? A. Gray. B. Light blue. C. Lavender. D. Yellow. Answer, D. Gray top tubes, used for glucose testing, are drawn last to avoid additive interference. Why is the lavender tube drawn after light blue and green tubes? A. It clots faster. B. EDTA can interfere with other tests. C. It's easier to handle. D. It has no additive. Answer, D. EDTA can interfere with calcium or coagulation tests, so it's drawn after citrate and heparin tubes. When should the tourniquet be removed during venipuncture? A. After needle removal. B. After tube removal. C. As soon as blood starts flowing. D. Within 1 minute. Answer, B. The tourniquet should be removed as soon as blood flow is established and within 1 minute. Which tube would be used for a CBC test? A. Red. B. Green. C. Lavender. D. Gray. Answer, B. Lavender top tubes contain EDTA and are used for hematology tests like CBC. Which of the following may cause hemolysis in a specimen? A. Using the correct gauge needle. B. Inverting the tube too gently. C. Vigorous shaking of the tube. D. Using gloves. Answer, C. Shaking the tube too hard can rupture red blood cells, causing hemolysis. The yellow-topped SPS tube is used for A. Glucose tests. B. Coagulation studies. C. Blood cultures. D. Drug monitoring. Answer, C. SPS in yellow-top tubes is used to preserve blood for microbiology, especially cultures. What is the additive in a gray-top tube? A. Heparin. B. Sodium fluoride and potassium oxalate. C. EDTA. D. Sodium citrate. Answer, A. Gray-top tubes typically contain sodium fluoride and potassium oxalate for glucose and alcohol testing. Why must blood culture bottles be filled before other tubes? A. They contain anticoagulants. B. To prevent cross-contamination. C. They need the most blood. D. They are time-sensitive. Answer, D. Blood cultures are filled first to reduce contamination and ensure accurate microbial detection. What happens if a lavender tube is drawn before a light blue tube? A. Test results are more accurate. B. No impact. C. Possible contamination by EDTA. D. Prevents clotting. Answer, A. EDTA from lavender tubes can alter calcium levels, affecting coagulation results. In what situation is a royal blue tube used? A. Blood glucose testing. B. Therapeutic drug monitoring. C. Trace element testing. D. blood cultures. Answer, C. Royal blue tubes are specially designed to test for trace metals like lead or zinc. Which of these tubes contains no additives? A. Lavender. B. Red, glass. C. Gray. D. Light blue. Answer, B. Glass red top tubes contain no additives and are used for serum collection. What does EDTA do in a tube? A. Breaks down glucose. B. Encourages clotting. C. Preserves cells by binding calcium. D. Coagulates the blood. Answer, C. EDTA prevents clotting by binding calcium, preserving cell integrity for analysis. If a coagulation test is ordered, which color tube is selected? A. Green. B. Light blue. C. Lavender. D. Gray. Answer, B. Light blue tubes are used for coagulation studies due to sodium citrate content. The gold top tube has which of the following? A. EDTA. B. Thrombin. C. Gel separator and clot activator. D. Sodium fluoride. Answer, C. Gold top tubes contain a clot activator and gel for serum separation. Which additive prevents clotting by inhibiting thrombin? A. EDTA. B. Heparin. C. Sodium citrate. D. Sodium fluoride. Answer, B. Heparin works by inhibiting thrombin and is used in plasma testing. The correct order of draw starts with A. Gray. B. Yellow. C. Green. D. Lavender. Answer, B. The correct order begins with blood cultures, yellow, then light blue, red, etc. Which tube contains an additive that preserves glucose for up to 24 hours? A. Lavender. B. Gray. C. Red. D. Green. Answer, B. Gray tubes with sodium fluoride prevent glycolysis, preserving glucose levels for extended testing time. What additive is in a pink top tube? A. Sodium citrate. B. Potassium EDTA. C. Sodium fluoride. D. None. Answer, A. Pink top tubes contain potassium EDTA and are used primarily for blood bank testing. Which of the following tubes must be inverted 8 to 10 times to mix properly? A. Red glass. B. Lavender. C. Gold. D. None of the above. Answer, D. Tubes with additives like EDTA, lavender, require 8 to 10 gentle inversions to ensure proper mixing. What test is typically performed with blood collected in a gray top tube? A. Liver function. B. CBC. C. Glucose testing. D. Platelet count. Answer, C. Gray top tubes preserve glucose and are used for glucose and alcohol testing. What is the main reason to follow the order of draw? A. Save time. B. Reduce lab errors. C. Prevent additive cross-contamination. D. Increase sample quantity. Answer, C. Following the order of draw prevents additives from contaminating subsequent tubes and affecting test results. Which tube would you use for an erythrocyte sedimentation rate (ESR) test? A. Light blue. B. Lavender. C. Red. D. Gray. Answer, B. ESR is a hematology test, requiring EDTA found in lavender top tubes. In which color tube would a lipid panel be collected? A. Lavender. B. Gray. C. Gold. D. Green. Answer, C. Lipid panels are serum tests and are commonly drawn in gold top tubes that include a gel separator. Which tube is used for toxicology and trace metal testing? A. Royal blue. B. Gray. C. Light blue. D. Lavender. Answer A. Royal blue tubes are certified trace element free, ideal for heavy metal analysis. What does the yellow-topped ACD tube test for? A. DNA and genetic studies. B. Glucose. C. Coagulation. D. Microbiology cultures. Answer A. ACD, acid citrate dextrose, tubes preserve white cells for DNA and HLA typing. Which additive is a glycolysis inhibitor? A. Sodium citrate. B. Sodium fluoride. C. EDTA. D. Thrombin. Answer B. Sodium fluoride inhibits enzymes involved in glycolysis, preserving glucose in blood specimens. What order should the following tubes be drawn? Lavender, red, light blue. A. Lavender, red, light blue. B. Red, light blue, lavender. C. Light blue, red, lavender. D. Red, lavender, light blue. Answer C. Light blue comes first for coag tests, then red for serum, and lavender last for hematology. What tube is used for ammonia levels and must be chilled immediately? A. Lavender. B. Light blue. C. Green. D. Gold. Answer C. Green top tubes with heparin are used for ammonia tests and require immediate chilling. What is the function of the gel in SST tubes? A. Promotes clotting. B. Inhibits glucose breakdown. C. Separates serum from cells. D. Prevents hemolysis. Answer C. Gel in SST tubes separates serum after centrifugation to ensure accurate serum testing. Which tube should never be used for calcium tests? A. Green. B. Lavender. C. Red. D. Light blue. Answer B. EDTA in lavender tubes binds calcium, making it unsuitable for calcium assays. What is the correct number of inversions for a light blue top tube? A. 3 to 4. B. 5 to 6. C. 8 to 10. D. None. Answer A. Light blue tubes require 3 to 4 gentle inversions to properly mix citrate and blood. If you draw a gray tube before a red top, what might happen? A. Accurate results. B. No effect. C. Contamination of glucose preservative. D. Clotting. Answer C. Additives from the gray tube may contaminate the red top tube and interfere with tests. Which of the following tube colors typically contains thrombin? A. Gold. B. Orange. C. Green. D. Lavender. Answer B. Orange top tubes contain thrombin and are used for rapid clotting. When drawing for a stat potassium test, which tube is appropriate? A. Gray. B. Green. C. Red. D. Light blue. Answer B. Heparinized green tubes are used for plasma potassium tests, especially in stat situations. The red plastic tube contains which additive? A. None. B. EDTA. C. Clot activator. D. Sodium citrate. Answer C. Plastic red top tubes typically contain a clot activator to help serum separation. Which tube should be drawn before a lavender tube? A. Gray. B. Green. C. Red. D. All of the above. Answer D. All these tubes must be drawn before lavender to prevent EDTA interference. What test uses yellow top tubes with SPS additive? A. ESR. B. Blood culture. C. Glucose tolerance. D. HCG. Answer B. SPS tubes are specifically used to collect specimens for blood cultures. Which of the following tubes is used for coagulation studies? A. Gray. B. Light blue. C. Red. D. Lavender. Answer, B. Light blue top tubes contain sodium citrate, ideal for coagulation testing. What test is performed from blood in a lavender top tube? A. Electrolytes. B. Glucose. C. Hematocrit. D. Bilirubin. Answer, C. Lavender top tubes are used for hematocrit and other hematology tests. Which tube follows the gold top in the order of draw? A. Green. B. Gray. C. Lavender. D. Light blue. Answer, C. After serum tubes like gold, EDTA tubes, lavender, are next in the order of draw. Which tube should you use for stat plasma testing? A. Gray. B. Green. C. Red. D. Gold. Answer, B. Green top tubes yield plasma quickly and are used for stat chemistry tests. The green top tube is used for tests requiring A. Serum. B. Plasma. C. DNA. D. Microbial growth. Answer, B. Heparin in green tubes prevents clotting and is used to obtain plasma for testing. What could occur if tubes are not inverted as required? A. Hemolysis. B. Test accuracy improves. C. Clotting in anticoagulant tubes. D. No effect. Answer, C. Inadequate mixing prevents anticoagulants from working, leading to clotting. A test for ethanol, blood alcohol, is drawn in which tube? A. Lavender. B. Gray. C. Gold. D. Green. Answer, B. Gray tubes preserve ethanol levels with sodium fluoride, reducing metabolism post-draw. What is the primary risk of drawing in incorrect order? A. Longer procedure. B. Patient discomfort. C. Cross-contamination of additives. D. Improper labeling. Answer, C. Drawing out of order can cause additive contamination, affecting test results. Which test must be drawn in a tube with no additive? A. Serum calcium. B. CBC. C. Point/INR. D. Glucose. Answer, A. Some chemistry tests like serum calcium are best collected in additive-free red glass tubes.